Good afternoon, everyone. I'm Governor John Carney. Thank you for joining us for our weekly COVID-19 press conference. I'm joined once again this week by Dr. Carryl Rattay, the Director of the Division of Public Health. Dr. Rattay, thank you for being with us today and for the great work of your team at Public Health. A.J. Schall is back with us again today as well, the Director of the Delaware Emergency Management Agency. We've got some important information to share with you about the status of COVID-19 spread in our state, things that we're seeing in terms of where that spread exists, situations in our schools, and what we're hearing back from contact tracers. So we'll get to all that, but first I wanted to start out. Last week at this time we were in the middle of an election, and I just want to thank the more than 500,000 Delawareans who went to the polls last Tuesday to express their preferences in the election. I want to thank every one of them for making the effort. We had almost 200,000 Delawareans vote by mail or absentee vote, and so we were able to have a presidential election, an election for offices, statewide and local offices here in the state of Delaware during a COVID-19 pandemic and do it safely. And to that end, I want to thank Anthony Albans and his team at the Department of Elections, all the poll workers, all the individuals who were out there at the polls, monitoring and making sure that the new machines were working well. We were moving people through quickly. There were long lines, as I mentioned last week in our press conference, at every polling place that I visited. People were waiting patiently. They were respectful of one another, notwithstanding the candidates that they were supporting. We had a lot of concern about different incidents that might occur. There may have been something that was isolated, but I didn't hear of any of that, frankly, here in Delaware, and Delawareans are to be commended with that. In fact, all the Delawareans that I talked to, whether they're voting for me or not, or voting for my preferences or not, were very respectful as they entered the polls and left them, and so we want to thank really everybody for that. I also want to thank our DTI, Department of Technology, Information and Technology, for their efforts, and the cyber team that we deployed from the National Guard, who helped and to secure the election systems, the voter files, and all of that. And to the best of our knowledge, everything went smoothly there without any problems. The new machines worked and worked well. You know, our thoughts and prayers are with former Elections Commissioner Elaine Manlove and her beloved husband Wayne, who were killed tragically in an automobile accident just the day before election. We laid her to rest yesterday, and she just provided tremendous service to our state and was a great friend to many of us. We're also, we have Veterans Day coming up, and where we show our support, our appreciation, our love, frankly, for those who fought and served to protect our freedoms, to protect the freedoms that we exercised just a week ago on Election Day. Normally, we celebrate Veterans Day with a ceremony out at the Delaware Memorial Bridge. It's always been one of my favorites, going back nearly 30 years to the days when I was actually a staff assistant for then Senator Joe Biden. And it's an opportunity really to thank and show our appreciation for those who served our country. We're also this year honoring and recognizing 245 years of the United States Marine Corps. What an incredible group of patriots, and they have served proudly for 245 years, always the first ones in and never leaving anyone behind. So to each of you who served in the Marines, thank you for your tremendous service. And to all our veterans, thank you as we celebrate your patriotism and your service to our country on tomorrow. So let's go to the data. We're up to 27,000 total positive COVID-19 cases in our state. Sadly, the fatalities continue to rise at 722, One of the things that we look at every week is the number of hospitalizations, 127 currently, which is the highest it's been in some time. We still have a fair amount of capacity there, but this is a concerning number, that we're well over 100 hospitalizations now. Just a week or two ago, we were just around the 100 number, just around 100, and now we've ticked up, and this tends to be a lagging indicator. We're going to see in a few minutes that we're seeing increased cases, not as dramatically as other states, but certainly very serious increases that we're dealing with presently. So let's look at the distribution. 14,000, approaching 15,000 positive cases in Newcastle County, 3,800 in Kent County. Kent County, the cases there have continued to be the lowest and most stable, if that's the right terminology, but just doing a pretty good job in Kent County with respect to new positive cases. Sussex County continues to have the most positive cases now at 8,600. Again, as we've noted in the past week, 2 weeks, significant number of hospitalizations have occurred in Sussex County as well, and we know that we have less capacity there than we do in the northern part of our state. One of the criteria that we look at very closely is the percent of the tests that are given that are positive, right? And we've been talking about this now for about a month, the way we've calculated this percentage. The World Health Organization target is 5%. For the majority of the time that we were doing this, we were just calculating the percentage based on the persons who were testing positive, which is the top line there, 11.8%. So if you've been tested once and you get tested again, it doesn't get counted as part of the denominator in the calculation for the percentage. And so you can see that when you calculate the percentage of tests, which include people who have tested more than once, including myself, I think I'm up to 4 times being tested. In the top calculation, if I got tested again, I wouldn't be included in that calculation. And you'll see in a minute the difference between the number of persons that have been tested and the number of tests that have been administered. And so there's a little bit of confusion out there about what this exactly means. The middle measure, the percentage of tests, is actually the one that most states are using, that we will continue to transition to, and will give us a better idea of the spread, because we'll actually be calculating it with the number of people who are getting tested on a day-to-day basis. The number that's way too high is the number of new cases today at a 7-day moving average of 241. And for those of us, and there are lots of you, probably hundreds, maybe even thousands of you that follow our data dashboard on a day-to-day basis, have been tracking this, you'll know that that number is considerably higher than it used to be. Going back a month or two during the summertime, AJ, when we were thinking about whether we were on or off a quarantine list with New Jersey and New York. And our target then was under 100 new cases per day. So you can see we're 2+ times that, but we're also doing more tests. And the tests, the percent positive, gives us an idea of the comparison between 2 months ago and today. What's unacceptable, what we're worried about, is the fact that we have 241 7-day moving average new cases per day, and it's going the wrong direction. So fundamentally, our message today is, particularly as we move into the Thanksgiving holiday season, we need to do a better job. We need to make sure we're wearing our masks in public and in private. We need to make sure we're keeping social distancing. We need to make sure that we're particularly monitoring social environments where people go out to, not necessarily go out to a restaurant, but invite people over to watch a sporting event or a movie on TV, and have drinks and cocktails and enjoy one another's company without masks on. That's where we're seeing a lot of transmission, and Dr. Rattay is going to go over some of the information that we're gathering by having interviews with people who test positive. What we need to do is we need to push that number of new cases per day down, get it below 200, and continue to make progress getting it below that. So here's the total number of tests. On the right is the almost 600,000 total tests that have been. That's each an individual test, whether you've been tested once or not. The 369,000 is the number of persons, so you don't count somebody more than once they get tested, and you can see what a difference that would make in calculating the percent positives, because as we do our testing, AJ, 2,000, 5,000 a day, some number of those on this kind of ratio are going to be people that have been tested before. And in fact, we're encouraging people at the university community, they're encouraging their students and faculty, teachers and staff to get tested and get tested more at once. And so that number on the left, the 369,000, and its day-to-day equivalent is going to be less meaningful than it was 5 months ago. And so the number that we're using now is the total number of tests administered to make that calculation. And so been a lot of questions about that, and you just need to remember your middle school math and percentage calculations to understand the relevance of the new measure, the new calculation with the new denominator to do the evaluation of percent positive. So here's the graph we show each week, and you can see on that top line, which is the young adult line, ages 18 through 34, you can see it's starting to pick up there, and it has been separating itself, meaning that subcategory, that demographic has experienced more of COVID-19 spread than any other, and it's connected with unstructured social environments mostly. University communities, as we've said for weeks, we were in pretty good shape a week or two ago. We're seeing a little bit of an uptick after Halloween parties and Halloween activities that maybe weren't as structured as should be. Let's look at our COVID-19 data dashboard. Here's the 14-day view. The top left is current hospitalizations, the one that is most concerning as we ticked up to 127 hospitalized today. Our 14-day view of new hospitalizations, again, that tends to be a little bit up and down. It's still on a downward trend, but obviously adding new people to that hospital census on a day-to-day basis. The new positive cases is very episodic, meaning up and down on a day-to-day basis today, mostly because we're doing and getting results from testing in big batches. And so you see, if you look at the orange line, the orange or gold line, that's the day-to-day number of new positive cases. That's the top far right. And the blue bars represent the 7-day moving average. So it's more gradual, but headed in the wrong direction, as I said, to the point today where we're too far over 200 in territory we don't want to be in. And so we are back on quarantine lists and have been for a couple of weeks now in New Jersey, New York, and Connecticut, Washington, D.C., and others. On the bottom, you can see the bottom left and center are the two ways of calculating percent positives. The far left with the persons tested, meaning just the people that have tested. Once they're tested once, they're not counted again. And you see it's a much bigger number. The number, the one in the middle, is the percentage of tests, so additional tests for individuals. And so that's a smaller number because the denominator is going to be a larger number. And so that's at 4.4%, I think it was, 7-day moving average, under 5%. We'll talk about gating criteria for schools, and the criteria for movement from yellow to red is at 8%, so we're still below that. That's a measure we will continue to look at. In other states, that number's a lot bigger than that. And I think in 26 or 7 states, Dr. Rattay is shaking her head, yes, that they're above 8%, which she'll talk about in a little bit. So let's take a look, let's take another step back or another step up and look at the 90-day view. You can clearly see the trends And we're in a trend right now, a bad trend, of new positive cases. You can see that on the top far right. The orange line is the day-to-day count, and the blue bars, very narrow bars in this chart, are the 7-day moving average, but moving in the wrong direction from a summertime low where we were down around 50 new cases, I want to say, to now where we're closing in on 250. So percent of persons tested, again, same basic shape, but at a higher level. There we go. The middle, I'm sorry, the bottom left and middle for those percent positives, 90-day look. AJ got his gloves in, so we've got our personal protective equipment. All the beaks are full there. So just a reminder that the nonprofit relief funding from the CARES Act, round 2 is now open. So for nonprofit organizations that have provided critical services during COVID-19 pandemic, please learn more about this relief funding at decaresfunds.org. You can find out more about it and how to apply. And the question as we think about where we are with respect to the spread of COVID-19 today, we're in a kind of an inflection point where we have decisions to make because we've essentially have too many of our neighbors who are attending gatherings, mostly social gatherings, informal gatherings, maybe in private homes or in their own homes without masks and other precautions. Larger crowds than should be. And so we're seeing the positive cases are telling the contact tracers that they probably got it at this kind of a venue. And not so much at structured retail establishments, bars, restaurants, schools, all of the above, where people are following the requirements for mask wearing, social distancing, and doing a better job out of it. Our overall goals, as we've said for some time, are to have a healthy community, to get more children back in schools, and every school district now is gradually moving children back for in-person instruction, not every day, doing it safely with fewer children in schools in front of teachers. Some days the children are learning remotely. Other days, again, they're in-person instruction. And to get more Delawareans on the job. So those 3 objectives, and it's all really follows from having a healthy community, meaning fewer daily new positive COVID-19 cases. And so we need everybody to lean in right now because we're contemplating, I've asked the Division of Public Health to look at what other states are doing around us, Maryland, New Jersey, New York, Pennsylvania, to consider some of the restrictions that we had in place before, to come up with ideas that are focused on where the problem really is. And some of it is in venues that we just don't have as much influence and control over. And it's coming up with the Thanksgiving holiday where we're seeing a lot of that right in front of us. Usually my family, a big family, nearly 30 of us get together and have a big family gathering. We're probably not going to do that, mostly because my mother, who's almost 90 years old, is in that vulnerable population. She has grandchildren that have been going to school. She's got children, adult children, who live all over this part of the state and all over the country, frankly, which aren't traveling in. And it's a sacrifice for sure, but we don't want our mom to get sick and to be exposed to the COVID-19. So we're thinking about what are the restrictions that we can put in place, that we may be forced to put in place because the spread continues to increase. And so we need everybody to wear a mask, to keep social distancing, to keep your gatherings small and within family units, do virtual get-togethers. I had a Zoom call with my 2 sons last night, and it wasn't the best, but we had a chance to find out what was going on with their their jobs and in their lives, and that's important for all of us. And so just follow these instructions so that we can avoid some of the restrictions that we know other states are putting in place and that we may have to be put in place, get put in place as well. The next slide, I'm not sure I understand the whole thing behind this slide, but I understand most young people who watch television series would know what this really means. But for me, it means winter's coming, the weather's getting colder, people are going to be more gathered inside, and so we need to be careful, more careful about wearing masks and keeping social distancing. The next slide, again, is something that we wanted to just to accentuate the need to wear a mask and to keep social distancing during this holiday season. And so with that, I'm going to turn it over to Dr. Rattay, who's got some very important information to share about what we've been learning about the spread of the virus, the risks associated with it, particularly in school settings, and some of the decisions that we have ahead of us. Thank you, Dr. Rattay.
Thank you so much, Governor. So we are seeing increases, clearly, in the data. I want to start by showing you the geographic areas of concern. Now, we've been presenting this information by zip code for probably 6 to 8 weeks using the same methods. And this, by far, is the largest number of zip codes in the state of Delaware that are meeting this criteria of areas of concern. We are seeing our biggest increases this past week in New Castle County. So while Sussex still has the highest case rates, the highest rise in cases and percent positives is in New Castle County. As you can see, Bear is back on our watch list, not only 19701, but we have a high number of cases in the Bear, Christiana area, as well as Stanton and New Castle. Newark has rejoined the areas of concern with UD students as well as individuals not UD students. So we are again seeing some increases in the Newark areas, especially 19711. Sorry, Governor, but Claymont is on the list this week. Moving a bit further down, Middletown and Townsend are also areas in which we are seeing increased numbers of cases. So we have a close eye on Middletown and Townsend at this point. Moving down to Sussex County, Seaford, Laurel, and Delmar continue to be the hottest spots in that area, but we're also seeing Delmar and Lincoln and Ellendale are on the map. Selbyville, as well as Rehoboth, Dewey, and Bethany are on the list, and sadly, Georgetown is back on the areas of concern list. So clearly, a number of areas in Delaware now. The middle of the state has some increases in cases, but certainly not to the degree as now north and south. Let me shift gears to talk a little bit about long-term care. We still have 5 facilities that have significant numbers of cases between September 25th and November 6th. We have over 60 cases that have had either a positive staff member or a resident over this time period. And so as Secretary McGarrick talked about last week, we're doing a number of things to really enhance our response and support for long-term care, including hiring a new medical director and building incident response teams to help. We're really thrilled that we learned just a few days ago from the federal government that we are receiving a federal asset called Disaster Medical Assistance Teams, or DMAT. This is an asset that we had in the spring to help support us And again, we learned on Thursday that we got approval for the DMAT team, which just began yesterday on Monday. It's the same team of 5 amazing VA nurses. These folks are great in working with our long-term care facilities. The facilities are very comfortable with them, and what they are now beginning to do again, especially with the facilities where we have the greatest concerns, is supporting them with infection control procedures, whether that's how to isolate or quarantine or use PPE or support with their testing programs. They're here to really just really provide whatever support these facilities need to control spread of infection in these facilities. Also, we're really excited that when the incident response teams get up, this is a great team to help train the incident response teams. So again, really grateful to these amazing VA nurses who are really sacrificing their time to be a part of our response here in Delaware. Let me do another shift here and talk about schools. As we've talked about several times, and the governor mentioned as well today, we are looking closely, I think everyone's looking closely at the school reopening criteria, and I think we've all seen that our case rates have increased this week to 135, which keeps it in the red and really makes it more firmly in the red. But our percent positives, they have gone up to 4.3%, which has them in the yellow, and hospitalizations, as you heard, have also gone up, which has them in the yellow at a rate of 11.4. On the next slide, you'll see how we are taking a deeper dive into kind of better understanding what our community spread looks like and what our testing rates look like to inform decision making. And so if you go to the next slide, you'll see that, again, we are not only in the red for case rates, but also in the red for percent change for case rates, in the red or in the yellow for percent positive, but in the red for the change in percent positive. We're in the green for testing, so AJ, we're doing great with testing, which is awesome. But hospitalizations, again, is trending in the wrong direction. Even though it's a light green, we are headed in the wrong direction. So we're certainly keeping a really close eye on this, but also really important that we're keeping a close eye of what we're seeing as far as cases in the school setting or related to the school setting. So on the next slide, as we have been sharing on every Friday in our press releases, we share the numbers for staff and students in private and public schools. This is a cumulative number, so this is the total number from September 1st up to last Friday. And as you can see, in private schools, we have 40 staff and 78 students, and in public schools, 110 staff and 63 students. What this means is these are individuals who were potentially infectious while they are in the school setting. But what's really important here is that of all the deep dives we're looking into every single one of those cases, COVID-19 is not being spread primarily in our schools, and the spread is really occurring external to the schools. So the spread is really happening outside the school setting. So we really wanted to take a little bit of a deeper dive for you all today so you could kind of see what we're seeing and give you some examples. So on the next slide, well, again, the key point is really in-school spread is really rare. So we have really 3 examples for staff where we've seen in-school spread. And with these examples, it involves staff eating lunch together. And as I'm going to mention multiple times today, eating is really risky because people don't have their masks on with when they're eating. We haven't figured out a way to eat with a mask on. I don't know that we ever will. So you have to be able to social distance when eating. We have seen a consequence, in the school setting 3 times now with staff who have been eating less than 6 feet apart, where we have seen some in-school spread. But we are seeing, and in one of those examples, one of those individuals attended a wedding, which we know is a high-risk event, and so that's how it was brought. That individual then, was eating lunch with colleagues close together, and so it spread. So we've got kind of a high-risk event and a high-risk event matched together, and you can see how that spread happened. But again, spread among staff is not common in the school setting. Staff are doing an amazing job overall in the school setting with following the guidance with face covering and social distancing for staff and students. And this is why we're not seeing spread in the school setting. But we are seeing a lot of what I think is normal socialization, which of course we all enjoy, but taking place outside of the school settings that are really leading to this high number of staff and really high numbers of Delawareans becoming positive for COVID. On the next slide, people want to know how much, spread are we seeing between students? And we've only seen two examples that we know of where there has been spread between students and schools. One involved likely one student infected another while they were playing tackle football at recess without a mask. We have one other example of 2 students who were eating together and not socially distanced. So that is likely how the one individual became infected from the other. But in all these examples or I shouldn't say all these examples, in these 5 examples of in-school spread, which is really, really not much at all, it was because the individuals weren't social distanced or weren't wearing a mask. But we are seeing, in the students that are in those numbers that we mentioned who are positive cases, some have involved students carpooling without masks, so that's a higher risk setting than I think people are realizing. Got to have masks on if you're in a car with somebody who's not in your household. Slumber parties and other socializing taking place among students is how we're seeing a number of them being infected. We also have an example of a travel baseball team that went out of the state, and 10 individuals associated with this team became positive. So, we know from the interviews that members of the team and families were eating together and were together outside of the games. So not sure how the infection happened, but we know that distancing and mask wearing wasn't followed at all times. So on the next I want to use an example, which is just kind of common right now, and something that we really want people to be aware of, that parties are of concern. So one example is a staff member hosted a party of about 20 individuals, and there were individuals from multiple schools, staff members from multiple schools involved. And at this point, we know of at least 11 cases from that indoor party who have individuals who are now positive. Another example involves a student who attended a large family gathering, and later they found out that the grandfather tested positive, and so and there was no social distancing or mask usage at the gathering, and so then 3 days later, both the mother and the brother tested positive. So these are really examples of what we are commonly seeing. Again, the in-school spread is really, really rare, but it's what's happening in the community. And so, with all of our data that we're looking at, with the clusters that our epidemiologists are analyzing, it's social gatherings, and it's large social gatherings, and it's small social gatherings. And this is, even, 4 people getting together to watch a football game, or, activities where people would normally engage in being together, oftentimes eating, oftentimes drinking, where they're not wearing face coverings, weddings, funerals. We have seen, unfortunately, a number of outbreaks related to religious services, some with very high numbers of infected people. But we've also seen a number of infections related to house parties. And in general, if I were to choose one behavior that I think is really driving a lot of cases, it's people eating indoors with either household members, because we are seeing in-household spread, or people who aren't a member of their household. Eating indoors, people aren't wearing face coverings, and that's really driving a large amount of the spread that we are seeing in our state right now. So we have to get a handle on how we approach social activities, because this is how this virus is being transmitted. And the recommendations are not going to be what people want to hear. This is really tough. On the next slide, here's kind of some key points. Only dine at home or in restaurants with people who live with you. Unless you're dining outside and distanced, that's better, but don't spend time with people outside of your household. And if you do, make sure that it's outdoors and that you're socially distanced and wearing a face covering at all times. And don't plan on holding holiday dinners with people outside of your household, even with family members outside of your household. We've got to keep it small this year. And we really, truly hope that this is the last year that we need to say this, but it's important that we do everything we can to turn this around right now. We are looking at the possibility of new restrictions, as the governor just mentioned, and we really have to target these interventions, these restrictions, as where we're seeing the spread. So looking at reducing the number of people permitted at both public and private gatherings is on the list. A number of states are implementing curfews on certain days where we know more people are likely to gather. We may have to consider strict restrictions on sports activities, perhaps indoor activities, or tournaments where there's a lot of mixing, or further updates to mask requirements. And we're telling you this now because this is not what we want to do. We don't want to be in a position where we have to put further restrictions in place, but we also don't want to have to close schools again and have any additional impact on the economy. This virus wants to spread, and this virus doesn't care. This virus doesn't care if you are tired of being cautious. This virus wants to spread, and any moment you are not cautious is when it may get to you or your family or friends. So all of us as Delawareans have a responsibility and the ability to help us turn this around, and we are asking that you help us so we don't have to take additional actions. We can do this, Delaware. We know that we can. So let me shift to something a little bit more positive, which is the vaccine. We got some exciting news yesterday that the Pfizer vaccine may be much more effective than any of us ever expected. And it still needs to complete the FDA review and approval process, but we in Delaware continue to ready ourselves for the receipt of this vaccine. The COVID-19 Vaccination Task Force continues to meet to develop our operational plan. Our response to the CDC playbook was just published last week, so we now have a spot on our website for the vaccine. You can find our playbook. You can find the executive summary there. I also want to mention that our ethics committee met last week to discuss the first groups that would receive the vaccine when it's available. We anticipate that the initial supply will be very limited. So we've been looking at the guidance from the ACIP, which comes out under CDC, and the first group of individuals that the Ethics Committee agrees with ACIP, certainly all those in long-term care workers and residents, but also high-risk workers who provide direct patient care, especially to those who may be COVID positive, are very high on the list, as are all first responders, as they don't know when they're encountering people with COVID and they must be protected. In Tier B, or the second group, in the first wave, again, high priority individuals include high-risk workers in all healthcare facilities not covered in 1A, so that would be primary care or those providing non-direct patient care, also those with underlying health conditions, and those in other congregate settings would be in Tier B. So, the Ethics Committee is going to continue to meet and work through these. Additionally, there's a communications subcommittee that held its first meeting yesterday. It's really important that we are effectively communicating what we know about the safety and the efficacy of the vaccine. When will this come to Delaware? We're not sure, but we are ready. We were told that it could come in October, so we have been doing everything we need to be ready. We know it's certainly not coming in October. At one point, we got a November 15th date. We don't think that's going to happen either, but we will be ready whenever it comes. We're thinking that's probably going to be December, but again, we are anxiously awaiting the arrival of the vaccine in Delaware. And with that, I will turn it back to you, Governor.
So thank you, Dr. Rattay, for ending your presentation with really good, positive news with respect to the possibility of a vaccine. So there's a little bit of light at the end of the tunnel. The efficacy really impressive in the 90% range. And as I understand, working with the diverse population, some additional work that needs to be done before they start moving the doses out to those specific populations that you mentioned. But in the meantime, we got to hold on. We've got to do better than we're doing. We've got to tighten things up. Again, we've been saying this for weeks about the informal social settings and gatherings, which is where the virus is most insidious and gets out and infects people and is transmitted one from the other. And so we really need to focus and lean in on those on restrictions and mask wearing in those environments. And I'm confident too that we can do it. And if we do it, we'll be able to reach our objectives of continuing to move children into classrooms and to getting more people back on the job and getting our economy going again. AJ, I know tremendous work that your team is doing on the testing front, and I know you got more information there today.
Thank you, and just so you know, we removed all the Game of Thrones references from this part of the presentation. Starting off with school testing, so Dr. Rattay spent a lot of time talking about schools and what we're doing with public health and the liaisons and contact tracing. So I want to talk about, kind of back up on what we've done really since prior to Labor Day to assist the school districts with testing as they were getting ready to not only having teachers go back in the buildings and staff, but then also entering kind of a hybrid environment. So over the last 3 months, we've assisted over 60 school districts with on-site testing. We've done this through multiple different vendors and partners that we've used to provide capacity in state. These have been done in coordination with the school districts. We use them to help spread the word. So they have the schools available to us, and they're spreading it out through their email blasts and phone notifications to make sure parents and students knew they had that accessibility right at their schools prior to going back into school. Well, we knew that was only a snapshot time. We know the testing is only good for really the time it was taken. So what do we do for ongoing? We know we have ample community testing, but we also want to make sure we are doing something to be as flexible with the school districts as well. So Mako Medical, another vendor that we've contracted with, is coordinating directly with school districts to offer multiple days of testing a month at different district schools, knowing that this would be a complementary process to our community testing and at-home testing that we're doing. So that has been going very well, and just started a few more sites up here in Newcastle County for the next few weeks. And then we continue to do routine at-home testing for the staff and the teachers of schools and all those that have other issues getting to a site. We've issued over 25,000 URLs for that at-home testing kits, and again, that is open up to Delaware residents or people that work in Delaware as well. So that's schools. Let's take it up a level and talk about just about the testing volume, just last 3 months, or last 2 months, and then kind of November, as of November 6th. 86,000 in September. We talked about how we saw a little bit of a decrease there. October, 131,000. So we, pushed hard in October. We set up additional sites in Newcastle County with the assistance of the county executive to really help us get to the school district. So some of the sites I was talking about on the previous slide, Red Clay, Christiana, Appoquinimink, we were doing multiple days there for their students. October really kind of is now the new high water mark. It really blew our last number out of the water for July and August. November, just as of the 6th of November, we were at 23,000. Just to put that in comparison, in April, we did 26,000 tests over the full month. May, when we started our community testing campaign, we were at 44,000. Yesterday, we set a single daily high, which isn't even in this number, of 5,200 tests just done on yesterday. So when the governor was talking about some of those peaks and valleys in the positive new cases, a great example is Sunday there was limited testing that was completed. So it would be the Walgreens, it would be some of the testing done in long-term care facilities. Monday we're back on full throttle with multiple sites across the state. We did 5,000. So you're going to probably see one day with a little bit smaller number. Then we're going to get probably a large number of those results back for that 5,000 between today and tomorrow, and then we'll have a day with potentially higher numbers. So you really have to kind of look at where the sites are, what day the testing took place to understand the number.
If I can interrupt there, AJ, I mean, that's a really important point as we look at the day-to-day number of positive cases, right? Because you get big batches of these results. They don't all come in under the same time frame. And so you get big batches on one day, so it's a big number, and the next day it's significantly less. The 7-day moving average really becomes more and more important, I would say, over the last month or two, as we've tried to assess what does the spread actually look at. The simple reality is the numbers are getting higher, and they're unacceptably high at this juncture. But sometimes you get thrown off with a really big number that's just a function of the testing and the results coming in.
No, absolutely, and I think we also want to talk about November. We have the second of 3 holidays tomorrow. We continue to test as many days as possible. So again, we have sites open tomorrow. We will have testing available over the Thanksgiving holiday as well. Might be at a little bit different tempo. We want to make sure it's used if and where we have it offered. So we'll coordinate with public health and our other partners to make sure that gets communicated in advance. The other question, I know we have a lot that I wanted to cover a little bit more in detail today, is the turnaround times of the labs. So in Delaware, we primarily have 3 partners that we utilize for state-sponsored events. Curative, which has been a great standard and great partner since May that we engaged with them. They are the ones that they're the trailers at right now, or if we go to one of our bigger drive-throughs, they're the ones facilitating it. We have Vault, which is the at-home process, so what we use for the teachers and staff of schools, as well as those that sign up online. And then the Walgreens partnership, which is run at the Delaware Public Health lab. So we know from Curative, from the time a collection gets sampled gets taken to the time that individual receives that notification is under 24 hours. It was 21.5 hours last week. We had information on a call this morning. Somebody went yesterday, got tested yesterday afternoon, had their results this morning when they woke up. So even sometimes we're closer to the 14, 15 hours there. Vault, 17 hours from the time that they receive the package. So remember, this is something that you request, gets sent to you, you log online and complete it, you drop it off in a UPS mailbox. So from the time it gets to the lab in New Jersey and they receive most of their shipments by 10 o'clock in the morning, from that time on, it's less than 17 hours. So again, you could almost plan that out to the hour or the day that you want to get your results back. And the Walgreens is less than 72 hours across the board. I think that number is probably, we could even probably say 48, but I want to make sure we, under promise and over delivered on that one. And we have email and text notification for them as well. Mako, the company that we are doing with schools right now, is right around the 24-hour mark as well. They are on site maybe a few days a week, and then get those right up to their lab up in Pennsylvania. So they're under 24 hours as well. People sign up online as well, do a portal registration, and they're able to get their results as soon as they're completed. Testing this week, 26 pop-up sites, again, going for a new record on top of the 22 statewide permanent locations. And then again, don't forget about the at-home testing, a great feature that we could be using going into the holiday season, especially if people are looking to travel or if students are coming home from a school or someplace out of the state or out of the region. DE.gov/home test to register for that. Know your status. We want to make sure that all the testing sites are updated. These are the ones that the states do. This is the ones we hear from our partners in the community, whether it's the hospitals, whether it's some of the federally qualified healthcare systems that we work with. So a lot of information is at de.gov/get-tested. Last slide I have is 30 seconds to talk about the disaster declarations. So back in March, when we started COVID, a presidential disaster declaration was approved for every state and territory in the United States. And we have to date been able to recapture some expenses that either the state or qualifying nonprofits have put in for. We have $37 million obligated back through that, with 44 projects that are also in works. Tropical storm Isaias, which hit us in early August, we also received a presidential disaster declaration for Kent County, and that was for public assistance as well. When we do a disaster declaration, public assistance is for this response from the state in emergency services, utility companies that are nonprofits, as well as any public infrastructure damage. And then the individual assistance side is what helps the individuals out. We did not have the magnitude for individual assistance, but we did for public assistance. It got approved for Kent County. And just this weekend, we submitted an appeal for Newcastle County for public assistance to try and recoup some of the funds that the county, the municipalities, DelDOT, DENREC, state police incurred over that really 5-day event that we had that had a lot of damage up in Delaware. So that is it, sir. Back to you.
Thank you much, AJ, and it needs to be said, word of thanks to you, to our partners at Newcastle County, to everyone that's chipped in to just blow past our original goal of 80,000 tests per month. I didn't think we could get it. I always thought it was going to be a stretch goal, and yet you set the record at, what was it, 130, almost 132,000, and you're on pace to go up over 100,000 again this month. Significant testing in communities, particularly vulnerable communities, so critically important, and just really an outstanding effort. And also something that people need to focus on and be aware of as we assess the spread of the virus on a day-to-day basis. When you look at the number of positive cases, you got to compare it to the number of tests that were done, the percent positive. Again, we're not where we want to be. The percent positives are getting worse. The number of positive cases are getting worse, but we are under the target there on percent positives of 5%, even with your big number at the University of Delaware that came in right at 5%, I think. And so, but we do need to buckle up a little bit. We need to be conscious of the social gatherings of Thanksgiving and the holidays to make sure that we protect ourselves and, most importantly, our neighbors. Just a reminder about downloading the app onto your phone. It's a way to help protect yourself by slowing the spread and just being made aware of coming in contact with somebody who's tested COVID-19 positive. You've been within 6 feet of them for 15 minutes. If they voluntarily sign up with the COVID Alert DE, and you do, then you'll get an alert to let you know that you've been potentially exposed and you can take appropriate action. We're in flu season. Make sure you get your flu shot. Of concern to a certain extent with respect to the hospitalization number that we talked about earlier. So far, the feedback we've gotten from the hospitals is they haven't seen a tremendous uptick in hospitalizations due to the flu. It's still early there, I think, and so we need to be very careful and try to push those hospitalization rates down by following the guidance and the restrictions and preventing the spread. So with that, we have some media in the room, and we have some pre-submitted questions. I see Tom or Sarah, whoever wants to go first. Thank you again for joining us.
Well, good. So, Governor, I have a question. Over the weekend at the Biden event, there were a lot of people outside the security perimeter, mostly masked, but not really all that socially distant. And in a lot of cases, people who were not, from the same household. So do you think it was appropriate to see that kind of a crowd out there? And are you worried about an outbreak stemming from that event?
Yeah, I do. I worry about it like I worried about some of the social protests that we had in the spring. Most people, as you observed, were wearing masks as I saw them leaving. The event itself was done in consultation with public health in terms of social distancing and the measures taken there. Everybody had masks on again. But the spontaneous crowd that just kind of gathered, there are things that are, frankly hard to control. But the formal gathering did have a consultation with public health and a plan in place with an approval to do so.
Karyl, do you have any thoughts about the crowd that was outside the perimeter?
Oh, by the way, and if I didn't mention this, I think I did, but if I didn't mention it, people who were there should get tested. Just like we recommended those who were involved in the social protests should get tested as well.
Karyl, do you have any thoughts about just the crowd itself? I mean, was DPH checking in on that? Because, again, you may have had the formal event inside, but there were a lot of people outside that were not, it was very unstructured.
Yeah, Tom, so we do, as the governor said, we do have concerns about any gathering, especially when people aren't social distanced. I will tell you, we really kept a close eye on the outcomes of the protests that we saw months ago. We did not see any incidents of spread from those protests. Again, by and large, people were wearing face coverings and, of course, outdoors. So, when we are, taking these deep dives into our data right now, it really is these indoor settings where people don't have face coverings on, where that's really driving the spread in our state. And so, frankly, I'm more concerned about, how many people were, gathering with friends, watching football games or watching the Biden speech at home, indoors, probably than those people that were gathering. But I do agree, those individuals who were gathering in less than 6 feet, they should get tested just to make sure.
Governor, on the schools note, I believe Philadelphia taking some action today to delay the return to in-person things there. You guys brought up the metrics that the state is looking at, and I think you only need 2, I think, if I recall correctly. Is that
2 in yellow?
2,
yeah.
Right. And so my question is, with where we're at with red right now, do you think schools need to anticipate, based on the trend that we're seeing, that they may need to go back to remote learning?
No, I think they should continue to with their plans to move children back into in-person instructions in the hybrid kind of way. We'll keep our focus on it, particularly in identifying particular geographic areas where there's outbreaks. But what we're seeing around the world in Europe, you've got restaurants and bars that are closed. They're required to be closed and schools opening, and it goes to the data that Dr. Rattay was summarizing with respect to where spread is occurring and where it isn't occurring, and it's really those social, kind of off-campus, unstructured social environments where people leave their guard down a little bit, aren't wearing face coverings, and that type of thing. And I think that the teachers and staff, the school districts are doing an exceptional job gradually moving children back into the hybrid model with some in-person instruction and some remote. And for the time being, I think that's appropriate.
Last thing I just have to ask, you mentioned earlier that you guys are looking at new restrictions. Are you considering any kind of capacity or operations limits for businesses?
Yeah, I mean, I think a lot of things are on the table, mostly things that are being done in other states around us. You know, we always, through the 9 months, going into 9 months of this, have been tried to be consistent with what's happening in states around us so we don't create cross-border incentives as we did at one time with beaches and with liquor stores in the northern part of our state. And so we'll continue to look at that and really try to make sure that the solution or that the restriction is geared and focused towards the problem. And it's a little bit hard to do that, given that the problem seems to be these informal social gatherings, you know. It's riskier to be with a crew having pizza and beer, watching a football game with 10, 15 folks at your home than it is in a more structured environment outside, particularly outside and outside of the home. So all of those things we'll be looking at to try to, we can't allow this thing to rage out of control again.
Thank you.
Thank you.
How are you, Governor?
Good, how are you?
Good. Tom asked two of my questions, but related to what you were just talking about, I did want to try to get to some specifics, if we can, about what is on the table and what is off the table. And the reason that I'm asking that, in terms of restrictions, the reason that I'm asking that is because you said back in October that the state isn't going to be able to do a shutdown similar to the one that we went through earlier this year, that wouldn't be sustainable. So I really am curious to hear, I know that you're looking at other states to, kind of make those decisions, but am I hearing correctly that at-home gatherings could be restricted if the spread continues?
Yeah, well, we tried that a little bit with respect to mask wearing within the homes, and we're not about to go knocking on doors and enforcing mask wearing in people's homes. I think it's really a question of, we rely almost exclusively, not exclusively, but largely on voluntary compliance. And so the question really is, how do you achieve that? And then what do you make voluntary and what do you make mandatory? And some of it is just signaling and messaging. And so you might say, well, wait a minute, why are you limiting outdoor gatherings to a number lower than the current limit, which I think is 250? And it's in some ways it's to signal that we need to be more careful. Actually, where we need to be more careful is on indoor environments. And actually, the unstructured indoor environments are the ones that are harder to get to, but the most, it seems to be where the greatest risk is, as opposed to indoor environments where you can impose restrictions like restaurants that can create barriers to transmission. And so those are the kinds that we're really trying to kind of hit a sweet spot or try to strike a balance that recognizes the needs of a healthy community and the needs of a strong economy, right? And it's a tough call.
Well, I'm wondering if businesses should brace for another shutdown of any kind. I'm just thinking about the repercussions of the shutdown earlier this year.
Well, I can tell you what they've been doing for months is finding more creative ways of delivering their product or their services. Whether you're talking about a retail establishment, and they've gotten really good at it. I mention my favorite Wawa all the time, because I go there every morning for my coffee. They're really good at it now. And I know restaurants with outdoor spaces are really good. Now it's getting colder, I get that, and they're looking at different ways to make that work. Same thing in New Jersey. I've seen outdoor dining. So folks are getting really creative, and we need to be certainly thoughtful and creative as we think about what kind of restrictions will get the job done in both cases, both in terms of business activity and in terms of the health of the community. And by the way, if you let the virus rage out of control, you're defeating the purpose, right? Because then people aren't going to go to restaurants and all the rest of it.
If I'm hearing you correctly, a decision has not been definitively made
Right.
yet about what's next, but is there anything?
I think it's important to lay it out there, what we're looking at, with a sense of urgency that says, let's do this voluntarily. Let's all pull together. Let's really wear a mask. Let's be cautious and conscious of what we're doing and watching, the sporting event or the movie with friends at home. I think about it a lot because my mother is in that vulnerable category, and we like to see her and she likes to see us. And if everybody thinks about it in those terms, and people do, don't get me wrong, I think we have strong compliance, which is why we've been better than all the other states. But now we're slipping in the wrong direction. And I think it's just people are getting tired and whatever. But when you see, like as we have today, where we've got a vaccine coming, come on, let's hang in there. Let's buckle down. Let's lean into it for a little while longer, and protect the gains that we've made in reopening businesses, in getting children back to school.
So I don't mean to keep prying about this, but I just want to make sure I'm not misunderstanding.
No, it gives me an opportunity to really lean into our message.
Could indoor gatherings, because I think it appears that indoor gatherings are happening more often and with more people without masks, including in this state. Should people expect, if these cases keep surging and people don't abide by the social distancing guidelines that you guys have put forward, that indoor gatherings could somehow be restricted in some way this winter?
We might have to do something that it gets the attention of folks so that it's more top of mind, right?
So I did have another question about something else that you already brought up, which is the vaccine and the Pfizer news. You mentioned, Dr. Rattay, that if I heard you correctly, December might be, we can expect perhaps the vaccine to become available in at least a limited amount of doses by December. And of course, the first people in line will be either at-risk groups or people who are most likely to contract it, like first responders, like you said. For the average Delawarean who is not high risk, which is a lot of the state, when can they expect to, at this point, when can they expect to get their hands on the vaccine?
Yeah, Sarah, I wish I knew. I really, and I wish I could say January, but likely, I think optimistically, maybe March, April, and probably really it will become more widespread late spring, summer. If it's before then, I think we'll all be dancing in the streets with face masks on. But I think it's a large quantity of vaccine that needs to be produced to vaccinate our nation, and so it's clearly important that we prioritize and we focus on saving as many lives as we can and keeping Delaware up and running. But we are really looking forward to the time when we have abundant supply of vaccine, and I just don't anticipate that any earlier than March, and I think that's optimistic.
Thank you so much.
Thank you, and thanks for coming. We also have some pre-submitted question from media across the state, and Haley's got those questions.
All right, first question is from Nick Ciolino at Delaware Public Media. How concerned are you about the level of guidance and support the state will get from the federal government between now and President-elect Biden's inauguration? What kind of contact does the state currently have with the White House Coronavirus Task Force?
Yeah, so I talk about our interaction with the White House Task Force almost on a weekly basis. We have a weekly call with the task force. Normally, it's the case that the Vice President coordinates the call with representatives from CDC, NIH, Dr. Fauci, Dr. Birx, more recently with the team that's been working on Operation Warp Speed with the vaccine, and so I would expect that that will continue. We'll continue to get updates on personal protective equipment that needs and stockpiling, so I would expect that that would continue.
Next question is from Amy Cherry at WDEL. This is for Dr. Rattay. Newark's Cafe Gelato is planning to use small greenhouses to continue outdoor dining into the winter. What concerns does DPH have as businesses need to find ways to keep capacity up to stay viable in the winter with the pandemic?
Yeah, that's a really great question. And I want to start by saying our Delaware restaurants have done an amazing job innovating and really being responsive to this crisis. And although, you've heard us say we have concerns about indoor dining, I think it's really fantastic that our restaurants are thinking about creative ways in which they can continue the outdoor dining that they've been able to establish for Delawareans. I don't know much about the small greenhouses that Cafe Gelato is thinking about. I'm hoping that they and others who are thinking about innovative ideas do collaborate with Jamie Mack and his team. We want to make sure that what they invest in is actually safe. Outdoor dining is great, but anything with walls has the potential to actually be more dangerous. Some people started using igloos in other parts of the country, and they were finding that actually that was even a riskier setting than even normal indoors. So we just want to make sure that whatever these restaurants are really focused on investing in is going to be a good solution.
Next question from Amy Cherry at WDEL. Under the former metric of persons positive, Delaware's reopening formula would have gone red last week. Can you explain why the new formula is being used and how you came up with the 8% as the threshold?
Yes, I'm going to turn it over to Dr. Rattay, but just we can show one of the slides earlier that showed the total number when you use just persons tested for that percent positive, 369,000, compared to when you use the total tests that are administered. It's almost 600,000, big difference there. And so the more relevant calculation is using the 599,000, so the total test, to give you some idea of the current spread of the virus in the community. So it's more meaningful, and Dr. Rattay and Public Health recommended that we move towards it. Most states are doing it, and there's another part of that question, I guess, that you can answer with respect to the 8% threshold. We did say earlier that, unfortunately, 20-some states are already above 8%, and so it's certainly not a threshold that some states haven't crossed already.
Yeah, I mean, I think we all believe it was absolutely the right thing to do to move to the test-based approach, because the person-based approach really is no longer as this far into the pandemic, when many people are getting tested multiple times. The person-based measure just isn't a great indicator of true community spread. And so the test-based measure is a better metric to follow. Now, the CDC and the White House Task Force and Hopkins and others use 10% as the metric for test-based positivity. We felt that that wasn't as true of a reflection of community spread, and that we needed to be more conservative than what CDC and the White House and Hopkins were recommending. So we decreased to that 8% as the threshold because, again, we felt that we needed to be more conservative, and we wanted it to be a closer match to community spread. And as the governor said, when I looked last week, over 26 states were already over that 8%.
Next question's from Jacob Owens at Delaware Business Times. With the election of President-elect Joe Biden, how does the state anticipate taking advantage of this newfound spotlight on Wilmington and the state of Delaware as a whole, whether through leveraging federal resources, attracting new economic development, or boosting tourism?
Yeah, so I think it's a real opportunity for our state to get a lot of attention. Obviously, the eyes of the world were on Wilmington, Delaware, just a week ago, or just a few days ago over the weekend, when President-elect had his speeches and Vice President-elect accepting the results of the election. And so I think we'll continue to see that. We'll certainly use it in marketing Delaware as a place to do business, and certainly for tourism purposes. It'll be an opportunity for us to attract visitors, more visitors. We have a thriving tourism industry already, notwithstanding the effects of COVID-19. Some of the best beaches in the world, just a wonderful place to live and work, and so we'll have a chance to emphasize all of that by being the home state of the next president of the United States. And we're all very proud of Joe. We're proud to be Delawareans, and I think it'll be good for us. You know, we've always done well by our congressional delegation as long as I can remember, Democrats and Republicans. So Senator Carper, Senator Coons, Congresswoman Blunt-Rochester now, with respect to federal resources, and I certainly can't hurt with our own Joe Biden in the White House. But the main things will be tourism and economic development, and just a sense of pride. We get to puff out our chests a little bit and be proud that the President of the United States calls Delaware his home.
So last question from Tim Furlong at NBC. What are your thoughts on potential changes to your COVID strategy now that President-elect Biden won? Have you discussed this with their team?
Yeah, so I've had a brief conversation with some of their staff with respect to their approach and maybe some of the concerns that we have. We've put together a really strong team, I expect, and the President-elect formed a COVID-19 task force, put really top-notch scientists in charge, representing different approaches to public health. I think that's going to be great and helping us sort out the science and finding the best approaches. We depend on the federal government in a big way for resources, for personal protective equipment, for testing supplies, and we also expect and do better with some flexibility at the local level with respect to the implementation of emergency orders, and expect that that'll be part of it, but kind of a stronger, messaging. Messaging is important, when face covering is such an important part of our response to mitigation on COVID-19. Having that kind of example set by the President of the United States makes a difference, and so we'll expect that. But clearly, we've had a good relationship with the White House Task Force, and we expect that that'll get even stronger with the Biden team in force, and hopefully we'll get to the point where we're really talking about distributing vaccines and getting really back online again. So that was the last question. Again, I want to thank everybody for joining us again this week. Thank Dr. Rattay and A.J. Schall for their tremendous work and the work of their teams. Again, tomorrow's Veterans Day. I want to thank all of the veterans, those active duty, military, and veterans who have served our country and served it so well, made it possible for all of us to exercise our right to the vote just a week ago today, in which we chose elected leaders at the national level and at the state level. And to that, I want to just express my appreciation and thanks for those of you who supported me in the re-election. It's a great privilege to serve with tremendous responsibility I'm a firm believer in the return day ethic, which says that the elections are now over. Yeah, we're Democrats and Republicans, but first and foremost, we're Delawareans, and it's our job to serve the best interests of every Delawarean, whether you voted for me or the other side. And I also want to extend my congratulations to my opponent and to all the candidates who ran in the election just a week ago. Thank you for joining us. Thank you to our veterans tomorrow. God bless you and see you next week.